Hi, my name is Dana, and I did my vulnerable population on homeless families. So I will just get started. So just a description of a homeless family. So a homeless person is someone who lives in a public area, a shelter, unsecure location, or living in temporary housing designed for homeless persons. That definition does not cross over to different countries. Other countries considered homeless people just anybody who doesn't have a house, but even though they have somewhere to live. Some countries divide it into sheltered versus unsheltered, and they only unsheltered would be like someone living on the street, but if they have a home, like if they're living in a temporary housing, they're considered not homeless. So there's a few different definitions, but generally this is what we see as a homeless individual. So the differences between a homeless family versus like an individual either had like something happen to them, like a certain event, like it can be like drugs or trauma or mental illness that happened with them. But for families, it could be anything from mental health issues like chronic job instability, adult physical disability, so like the head of the household becoming disabled and not wise and having issues making decisions for the family and basically leading the family down the wrong path. A lack of family or social network, and domestic violence or child abuse. So a lot of that would be like single mothers leaving their housing situation and now they're homeless and doing their best to survive. So size of the population. So locally in the state of Utah, we have an estimate of 3,131 individuals experiencing homelessness, with about 290 families that are considered homeless. So this could be anywhere from 1 to 2 adults to 1 to 2 children. It's just the family sizes, it could be varying. Nationally, so there was about 580,000 people homeless in the United States, that's estimated, and families accounted for almost 30% of that population, staying in sheltered or unsheltered. So that's on the streets and in temporary housing or stuff like that. Internationally, there are estimates that state that the homeless population is at 150 million, but also at 1.6 billion, or 20% of the entire population. Because, like I said, certain countries don't calculate their homeless population the way we do, or in our country, what we see as homeless or in poverty, other countries that is their every day, and that's what they deal with. So the statistics are a little bit varying on that, but for the most part, for the United States and the development of our country, our 30% of our population that is considered homeless is a huge number. So contributing factors. So economic, basically some social determinants of health that affect this population. Economic stability. So a lot of this population can't keep employment. They have disabilities or injuries that limit their work, and they cannot afford food, housing, or healthcare. Education is big, so prone to bullying is an issue as well. Decreased likelihood of graduating high school. The stress of living under poverty can affect brain development, and decreased information literacy and language is also an issue. Healthcare access. They may have decreased preventative care due to insurance coverage, therefore not having a primary care provider that can help manage illnesses and disorders. And then housing, of course, no consistent safe housing or transportation, and they may live in poor conditions with polluted air and water. So, contributing factors. So physical factors, just housing instability, psychosocial, lack of interaction with other families, lack of connection, lack of interaction with family, isolation, and lack of social cohesion. So lack of just feeling isolated is a big deal for families that are homeless. For economic concerns, living in poverty, so lack of access to substantial nutrition and the quality of housing. And then greater use of repeated hospital services. So that would be like using like every time they go to the doctor, they're having to stay longer because they haven't had the care that they've had if they've had a primary care doctor. It's costing, hospitals money, a lot more money, and it's just a lot more costly health-wise as well because their health is not being maintained as it should be. So contributing factor, root cause is health deterioration. So they're less likely to use preventative health services. They have poor control of manageable conditions such as high blood pressure, diabetes, malnutrition, increased mental health and behavior disorders. So the stress that these families get put under exacerbates mental health, and they don't get treated, and this only keeps them in this homeless cycle where this family is functioning and growing up in. So Maslow's hierarchy of needs. So their needs, I couldn't find anything that they really met from the bottom up. So physiological, they have inconsistent sleep, inconsistent food, and inconsistent water. It's not, like I said, each family is a little bit different of how they receive care, whether they're in temporary housing, if they don't have any shelter off, they're living in their car. So where they do this, they don't have comfortable needs met. Safety, no consistent sense of security with resources, family, or health or properties. They have nothing that they feel. It's not easy to feel safe in somewhere that they don't have as their own. Love and belonging. So as family might have each other, but that dynamic may be interesting. So they could feel isolated, and they won't be able to connect with others. They're not going to feel belonging to their community or their school because they're not really a part of their community or school. They live somewhere else, or they live, in a different temporary housing every once in a while. So they don't really feel connected to their community. Low self-esteem. So just they have mental illness, and they don't believe it's just hard for them. Self-actualization, most likely unable to achieve. Yeah, that's most people try to attain that, but being that they've had so many issues everywhere else, it's hard for them to achieve self-actualization when they don't have any of their other needs met. So anticipated functional level. So like I said, majority of the homeless families are not able to achieve basic physiological needs. They don't have those basic needs met. So if they get those met, then that's better than nothing, but that's not a good outcome, not for health. Likely health outcomes. So this can lead to decreased mortality, poor management of health conditions, behaviors, mental illnesses, and even oral health. So this is a pretty big deal. Some concerns: respiratory issues, asthma, upper respiratory tract infections, cough. So there needs to be increased access to medical care, decrease the potential irritants, and allow for continuity of care. Sexually transmitted infections, increase the sex education, provide condoms, and increase knowledge of use. Dermatologic issues, they have scabies and head lice. So increasing education of prevention and resources to rid, and encouraging good hygiene and provide resources. Malnutrition, iron deficiency, anemia, obesity, and stunted growth, And poor oral health is also an issue because of poor personal hygiene, lack of regular oral care, and we can just encourage oral care and provide education. These families have a lot of risks for self-care and self-harm because they've likely experienced trauma and been a part of stressful situations and may have had some substance abuse. So all these can lead to a mental health crisis, and poor mental health can affect sleeping, exacerbating mental illness and continuing homelessness. And risk for harm to and by others. So these individuals and these families have increased likelihood of abuse from others, sexually, physically, domestic abuse. They may have neglect, and again, the increased risk of unsafe sexual behaviors due to just risky behaviors. So, yeah. And those are my references. Thank you so much.